Schizophrenia is one of the most complex and yet least understood mental disorders, affecting the lives of millions of people around the world. This condition impacts not only the individual's mind, but also their social relationships, education, career, and overall quality of life. Let's dive in and explore the anatomy of this disorder. This image visually summarizes how different parts of the brain contribute to various symptoms. Step 1: Frontal lobe disorganized thinking in schizophrenia. The frontal lobe, located at the front of the brain, is responsible for planning and goal setting, decision-making, managing emotions and social behavior, organizing thoughts and speech. In schizophrenia, this region may be underactive or structurally altered, leading to disorganized thinking, poor decision-making, irrational or impulsive behaviors, difficulty focusing or problem-solving. In the animation, this might be visually reflected by flickering activity in the frontal lobe area, thought bubbles filled with jumbled words or symbols, the character appearing confused or mentally overwhelmed. This stage helps explain why individuals with schizophrenia may struggle to express themselves clearly, follow logical steps, or act appropriately in social situations. Step 2: Temporal lobe auditory hallucinations in schizophrenia. In the animated image, the temporal lobes are highlighted on both sides of the head, just above the ears. These brain regions are responsible for processing sound, language comprehension, and memory. For people with schizophrenia, the temporal lobe often shows abnormal activity, especially in an area called the auditory cortex. This overactivity can cause the brain to generate voices or sounds internally, which the person experiences as if they are coming from the outside world, a phenomenon known as auditory hallucinations. In the visual, sound waves or voice-like symbols are shown around the character's ears. The temporal lobes are glowing to indicate overactivity. Thought bubbles may show confusion or fear, reflecting how real and distressing these hallucinations can be. This stage explains how a breakdown in sound processing can make a person hear voices others don't, even when no actual sound exists. Step 3: Parietal lobe spatial confusion in schizophrenia. The parietal lobe, located at the upper back of the brain, plays a key role in how we understand space, touch, and the position of our body in the environment. In schizophrenia, this region may not function properly. This can lead to confusion about body position, for example, not knowing where your arms or legs are, difficulty understanding personal space, delusional thoughts about reality, such as believing the body is being controlled or distorted. In the animation, this may be visualized by a distorted or floating figure to represent poor body awareness, a foggy or warped background showing confusion about surroundings, misaligned limbs or a disoriented posture to reflect how the person perceives their body inaccurately. This stage helps explain how someone with schizophrenia might feel disconnected from their own body or unaware of where they are in space, which can be frightening and disorienting. Step 4: Occipital lobe visual hallucinations in schizophrenia. The occipital lobe, located at the back of the brain, is responsible for processing everything we see: shapes, colors, faces, movement, and light. In schizophrenia, abnormal activity in this region can lead to visual hallucinations, where a person sees things that aren't really there, such as lights, shadows, figures, or strange patterns. In the animation, this may be shown by glowing or overactive occipital lobes highlighted in the back of the head, imaginary shapes or ghost-like figures appearing in front of the character, confused or overwhelmed expressions indicating visual overload. This stage helps explain how faulty visual processing can cause someone to perceive images or events that don't exist, making their experience of reality very different from others. Step 5: Limbic system emotional dysregulation in schizophrenia. The limbic system is a group of brain structures including the amygdala and hippocampus. It plays a vital role in emotions, memory, and emotional responses. In schizophrenia, the limbic system may be overactive or underactive, leading to flat affect, reduced emotional expression, Unstable mood, sudden shifts in emotion. Difficulty understanding or expressing feelings. Disrupted memory of emotional events. In the animated image, this may be represented by a glowing amygdala and hippocampus inside the brain. Emotional symbols like hearts or faces flickering or breaking. The character showing confusion, numbness, or emotional swings. This step highlights how schizophrenia affects emotional processing, making it hard to respond or connect emotionally with others. Step 6: Dopamine pathways. Chemical imbalance in schizophrenia. Dopamine is a neurotransmitter, a brain chemical that helps control motivation, attention, emotion, and reward. In people with schizophrenia, certain dopamine pathways become overactive or underactive, which plays a major role in many symptoms. There are two key imbalances. Too much dopamine in some brain areas causes hallucinations, delusions, and paranoia. Too little dopamine in other areas leads to low motivation, flat emotions, and social withdrawal. In the animation, this might be visualized by glowing dopamine pathways like light trails connecting parts of the brain. Certain pathways overactive, bright red or flashing, while others are dim or broken. The character showing emotional dullness or hearing imaginary voices representing both excess and lack. This stage helps explain how chemical imbalances, not just structural brain issues, contribute to schizophrenia symptoms and why medication is often needed to restore balance. Main symptoms. 1. Positive symptoms, things added to the person's experience. Hallucinations, seeing or hearing things that aren't really there, for example, hearing voices. Delusions, believing things that aren't true, for example, thinking someone is spying on them. Disorganized thinking, confused speech, jumping between topics. Unusual behavior, odd movements or actions that don't make sense to others. 2. Negative symptoms, loss of abilities or feelings. Lack of motivation, avolition, trouble starting or finishing tasks. Flat emotions, showing little facial expression or feeling. Social withdrawal, avoiding friends and family. Limited speech, alogia, speaking very little or only giving short replies. 3. Cognitive symptoms, problems with thinking and memory. Poor attention, difficulty focusing on one thing. Short-term memory problems, forgetting things just learned. Trouble making decisions, difficulty choosing what to do. Main factors that can contribute to the development of schizophrenia. 1. Genetic factors. Image element, a visible DNA strand or double helix emerging from the character. Explanation, a family history of schizophrenia increases the likelihood of developing the disorder. It's not caused by one single gene, but a combination of genes that may make the brain more vulnerable. 2. Brain chemistry imbalance. Image element, colorful signals or electric currents across brain areas. Explanation, irregularities in brain chemicals, especially dopamine and glutamate, play a major role. Overactive dopamine transmission can cause hallucinations or delusions. 3. Prenatal health and environment. Explanation, if the fetus is exposed to certain stressors during pregnancy, it may affect how the brain develops. Examples, maternal infections like influenza or rubella. Malnutrition or vitamin D deficiency. Exposure to toxins, for example, smoking, alcohol, or pollution. These factors may subtly alter brain structure or chemical signaling, increasing vulnerability to schizophrenia later in life. 4. Birth complications. Explanation, difficult or premature births can lead to oxygen deprivation or trauma, which may affect brain development. Examples, low birth weight, prolonged labor, emergency C-section. These complications are linked to a slightly higher risk of developing schizophrenia in adulthood. 5. Environmental stress. Image element, a storm cloud, shadows, or downward pressure on the character. Explanation, high stress during childhood or adulthood, including trauma, abuse, neglect, or growing up in a highly dysfunctional household may act as triggers in someone already genetically vulnerable. How to care for someone with schizophrenia. Treatment methods from the visual breakdown. Medication helps reduce hallucinations, delusions, and confusion. Therapy, talking with a counselor to manage stress and emotions. Healthy lifestyle, regular sleep, nutrition, and exercise. Social support, friends, family, and support groups make a big difference. Routine and structure, having a schedule helps reduce anxiety and disorganization. Follow-ups, regular visits to the doctor to adjust treatment. Brighter prospects are within reach for individuals living with schizophrenia, provided there is adequate awareness, support, and appropriate treatment.